Great. Good afternoon, everyone. It's Janeen again. Thanks for joining me to talk about my favorite topic, which is wings. Your support is what makes all of this possible. So this presentation really is dedicated to you in appreciation for all that you do. So during the course of this presentation, please feel free to enter any questions in the chat section at any time, and I will answer them at the end of the conference. And here's what we're going to talk about today. The new vision for our programs, how we are managing our previous programs, how we have diversified our funding in the last months, and why your support is so very important. And then we'll have a few concluding remarks. So before we get started, I want to tell you a quick story. This is Elsa. Elsa's 34, and she's the mother of 6 children. She recently attended a mobile clinic to receive a Jadel hormonal implant. Elsa had long been afraid of family planning methods because of all the myths and misconceptions that are floating around out there. One day, when her oldest daughter, Karina, came home from school, she told her what she learned in her sex ed class that Wings had provided. Karina was so enthusiastic about the topic that she asked permission to attend a Wings youth camp, and Elsa agreed. Later, Karina brought Wings materials back home, and she and her mother talked about them. Elsa finally understood that her fears were unjustified, and she sought her method at the Wings mobile clinic. Elsa is extremely excited that her youngest child could be her last, and she's passionate about finding a job to help pay for her kids' schooling and other essentials that they need to thrive. This powerful connection between our youth and family planning programs is what we are striving for. So let's talk now about Wings' new model that we have recently implemented in the Alta Vera Paz. And you might ask, why a new model and why Alta Vera Paz? Well, over the past couple of years, we've seen a saturation of NGOs in the areas where we've been focused. That, coupled with the fact that we have worked for many years in the same geographic area, made it clear to us that in order to maximize our impact, we needed to move to a new high-need and underserved geographic area, and that we needed to more fully integrate our activities, which was something that we had not managed to do in the past. Alta Vera Paz is an area that has some of the worst health and socioeconomic indicators in the country, including the second highest fertility rate, the highest maternal mortality rates in Guatemala, including adolescents, sadly enough, the highest gender-based violence rates in Guatemala, and a low contraception use. Only a third of the mothers, the women, are using a modern birth control method at this time. It also has some significant barriers, including religion. This area was very strongly evangelized during Guatemala's civil war, and religion and advice from religious leaders weigh very heavily on individual decisions. A majority of the people are either Catholic or evangelical, 2 religions that, with very few exceptions, preach against family planning. Another significant barrier that we find in this area are ethnic and linguistic situations. Many residents of the area only speak their native indigenous language, which is not always spoken by healthcare providers. 90% of the population is of indigenous descent, mainly from the Kekchi ethnic group, with a small population of Pocumchi. This is a photo of our first ever family planning talk in Alta Vera Paz that happened just last week. Over 250 women showed up. Access is another problem for us. Much of the department is mountainous and difficult to access. This photo was taken from that same village where we were last week with the 250 women. Many of the communities still have no road access at all, and if they do, they often become impassable with the rains. So, in general, it's difficult for people to get in or out of their communities at any given time of the year. So the challenges are many, which is why lots of other groups are not working in the Alta Vera Paz. But we don't shy away from challenges at Wings, and we believe that our new strategy will be successful. So this new strategy has a comprehensive approach. We believe that it takes community buy-in to support and facilitate contraceptive use and people taking control of their reproductive lives. We will be targeting individuals, community leaders, local elected officials, women, men, and youth, combining education and services. We will also have integration of activities. For the first time ever, we will be working with all sectors of civil society and authorities in the same communities. We believe this to be more effective and efficient. For example, if we're doing outreach with women, we also want to be training local health workers to be able to respond appropriately to them when they need services. We also recognize that we can't do this on our own. We've worked hard to forge new partnerships in Alta Verapaz to help make our programs run smoothly. We've discovered that the doors are wide open to both the Departments of Health and Education, which is no small feat. One of their main focuses for 2013 is the reduction of adolescent pregnancies in the Alta Verapaz, and they are eager to have Wings be a partner in the effort. So besides the Departments of Health and Education, some other partnerships include the United Nations Population Fund. We will be partnering with their efforts to reduce adolescent pregnancies and gender-based violence through the school system. We have Mercy Corps, and we will be training their 103 field technicians on reproductive health topics to be included in their nutrition programs. POSMO is certifying our nursing staff on the insertion of the Jadel implant and IUDs at no cost. And Bayer Pharmaceuticals has agreed to sell us birth control methods and other medications that we use at cost. So our new strategy has two main components. The training and development component will focus on training community leaders, students, their parents and teachers, and the staff of other organizations in a training of trainer style. The goal is to achieve community buy-in and to change attitudes, perceptions, and eventually behaviors. The direct service component consists of a network of community health promoters that distribute temporary birth control methods, a combined cervical cancer screening and IUD and Jadel insertion mobile clinic, educational talks to groups of women about methods, individual counseling sessions, and home visits. The goal of this component is to increase access to sexual and reproductive health information and services. We have a couple of themes that we feel are so crucial to successful reproductive health programs that we will emphasize them across all activities in both components. And one is men's involvement. All of our interventions will emphasize the importance of men as responsible parents that participate in the reproductive health dialogue. We will also utilize our successful male-focused methodology to reach groups of men in the communities. Additionally, we've come to realize that you can't talk about reproductive health or family planning effectively without first talking about sexual and reproductive rights. So this becomes another action designed to motivate people in all of our activities to demand that their rights be upheld. The 2012 UN Population Fund State of the World Population Report confirms that family planning is recognized as a human right. So we'll take a quick time out here. Make sure that you're typing in those important questions into the chat window as you think of them. And we will take the time at the end to take a look at those. So we are currently carrying out staff training activities in the Alta Verapaz. We have an awesome, super motivated new group of 17 staff, and we are cross-training them all so that we have one unified team capable of filling most all roles in the field activities. In this photo, the staff is learning how to insert the Jadel implant. The educational field activities have already begun, and the mobile unit field work will begin in March. In the monitoring and evaluation realm, we have a great opportunity to measure our impact since we have not worked in the area before. We spent a significant portion of 2012 creating an organizational monitoring and evaluation strategy. Our first steps this year will be to carry out a baseline study in the Alta Verapaz to assess current attitudes and behaviors. And the goal of our strategy is to monitor behavior change, to improve our programming, to measure impacts over time, and to help us scale up in the future to be able to implement this model in other areas. Although most of our programming is moving to Alta Verapaz, 2 staff members are dedicated to providing support and supplying birth control methods to our networks of family planning promoters and youth peer educators in areas in which we previously worked. Educators Ana Roquel and Ana Lucia Gonzalez are covering the 4 departments of Sololá, Chimaltenango, Escuintla, and Zacatepeques. We recently received an extension on our Responsible Men, Healthy Men program, in which Wings partnered with other NGOs and USAID to bring HIV and AIDS prevention, education, and testing to high-risk migrant sugarcane plantation workers on the coast. Continually diversifying our funding remains one of our major tasks each year. So far, we have received good reviews and healthy support from foundations for our new model. We received support at the end of 2012 from new or unexpected sources such as West Wind, a new foundation for Wings who provided funding after learning about our new project. Pasculano, who is an ongoing supporter, gave us unsolicited funds as a result of Wings' shift in programming. And Foundation for Just Society is another foundation that first gave last year and decided to fund us again after learning about our new strategy for Alta Verapaz. So please keep in mind for us that if you have any connections with possible funders, we would love to hear about it. While getting support from foundations like these is important, individual giving from people like each of you is extremely fundamental. Your dollars give us the flexibility to invest in areas which are not traditionally funded by foundation grants, such as family planning methods and even staff salaries. I know this sounds very cliche, but we really couldn't do this life-saving work without you. You guys are the heroes in this story, and we sincerely thank you for partnering with us for so many years. Many of you have helped us not only with funding, but also with holding events. This picture is of a gathering at a home of a supporter, Hetty Friedman, in the Boston area. Besides being a lot of fun, these types of events are great for helping us meet new supporters and spread the word about our work. We will be reaching out to you again soon, as we will be releasing a new documentary in the coming months. Thank you for joining me today. I hope you found today's call interesting. But I would really like to hear what you have to say. As an organization, we are continually looking for your feedback. One way to get an idea of what you think is by taking our donor survey, so I invite you to do so if you haven't already. Please take a minute to send any questions that you have about this presentation or about Wings' work in general. And while these come in, let me share one more story with you. So this is Donna Mercedes. She is 52 years old, and she lives in a small village in a very remote corner of the Petén, bordering on Mexico. She has 13 children. She and her husband have both been evangelical pastors for 22 years. Mercedes is the daughter and granddaughter of midwives, and she herself became a midwife at age 16. She's been a volunteer family planning promoter for Wings for 2 years now. Mercedes says, quote, "I come from a very big family. My mother had 10 children. Nobody explained to me how to plan my family. If they had, I would have done it. When my 7th child was born, I got very sick, and the nurses and my husband insisted that I get operated on, but because I was scared, I didn't do it. Now I think that had I had fewer children, they would have been better off. When I began to receive more information about family planning, I decided to have the operation." Wings' services help a lot because there are no methods available in the health posts when the women need them. Now that I work with Wings, the women trust me and they come to me to tell me that they want to plan their families. As a midwife, Wings' presence helps me a lot because when there is a risky or difficult birth, I tell the couples that they should plan their families and that they should take advantage of the fact that Wings is bringing them methods, as there is no longer a shortage like before. As long as I can continue to help and work with Wings, I will happily do it. End of quote. Okay, so let's get started on the questions you've submitted. So the first question we have is, what has been the initial response of the new communities you are working in Alta Verapaz? Well, I can tell you that the response has been overwhelming, and while we've only been in a couple of communities so far, as that photo that you saw earlier in the presentation showed you, The women are coming out in droves to hear more about family planning, reproductive health, and how they can better take care of their families. This is an area that hasn't had very much in the way of reproductive health activity in the past. So in a sense, it's kind of a new and open territory for us to go in and really have a big impact. And besides just the acceptance in the communities, as we've been reaching out to the local officials, other NGOs in the area, the Ministries of Health and Education, we are also seeing this overwhelmingly positive response to our new activities there. Okay, question number 2. You mentioned that this is a 2-year project. What is the vision after those 2 years? Good question. So yes, we are talking about this as a 2-year project, more than anything in the sense of a pilot project, because this is a brand new model for us in a new area. We believe that we need a couple of years to lay it out, get a feel for the land, improve our interventions and activities as we go along and monitor what we're doing. And our hope is after the 2-year project, we'll have a very solid model that we can then replicate in other parts of the country, definitely the surrounding areas of the Alta Verapaz, potentially around the whole country, and we could also use the model to train other groups about if they would like to try and implement something similar in their areas. Question number 3, can you tell me more about the documentary? Yes, the documentary is a long-awaited piece of work that we're very excited about. Just a brief background, if any of you have looked on our website, you've seen some of the short videos that we have about each of our programs. The same filmmaker agreed to come back and shoot more film to create this documentary that will be somewhere between 30 and 40 minutes when we have it done, probably. And it really is more than, the short films really are more about promotion for the organization. They talk a little bit about what we do, but they're really promoting our activities. This documentary is going to be it's going to focus on the broader issue of the lack of reproductive health services and information in a country like Guatemala, all the barriers that exist to family planning method uptake, for example. And it's going to have a lot more, it's going to put everything into nice context, I think, to paint a clear picture about the importance of providing these kinds of activities and services in a country like Guatemala. And the documentary we are expecting sometime very soon, probably in the next couple of months, and we will definitely let folks know, and it's out and ready to be seen. Question number 4 is, where will the long-acting methods be provided? At Ministry of Health facilities? So what we will be doing in the Alta Verapaz is we will be partnering with both Ministry of Health facilities, but also other organizations that might have an adequate facility for us to send our mobile unit to and do the procedures in their facilities. So our mobile unit is really what it is it's a pickup truck with an oversized camper on it, and we carry all of our equipment in the truck, and we travel to a facility that has been pre-prepared for this, and we lay everything out and do the procedures there. So yes, we will do them both at Ministry of Health facilities, but also can be private facilities, could even be private medical clinics, whoever is interested in partnering with us on this activity. And we will continue to work with OPRAFOM as something that I didn't mention before for the permanent method. As WINGS has always done in the past, we have subsidized the vasectomies and the tubal ligations for people through OPRAFOM, and at least for the first part of the year, we will continue to do that in the Alta Verapaz. The next question is, are there any volunteer opportunities for non-local people? Well, yes and no. we don't have as many volunteer opportunities as some of our colleagues here in Antigua. Some of the other NGOs here really are based 100% on volunteer service. Because of the very nature, the sensitive nature of the reproductive health, the family planning, the gynecological services that we do, it's not quite as easy for us to include volunteers on a regular basis in our activities. Having said that, however, we do typically every year have at least a few people. We frequently will have Masters in Public Health students that will come down for a few months and help us do an evaluation of a particular component of one of our projects as part of their thesis work. We will have medical personnel, doctors and nurses, come periodically to go out with our mobile unit and both participate and observe and give helpful hints and just be another helping hand. But really the key point of all this, though, is that it pretty much needs to be a Spanish-speaking person, because here it's not very common that people speak English. And so particularly out in the communities, it would be impossible to get around without the Spanish. Here in the office, we periodically have some volunteers doing a little bit perhaps more boring but very crucial things, helping us with administration, helping us in our fundraising department, and that position actually doesn't require as much Spanish. So the long and the short of it is, let us know if you're interested. However, we are not able to place too many volunteers at any given time. Is your new strategy based on an existing model of another group, or is it something new? That's an excellent question. Our new strategy is really something new. I mean, we certainly spent a lot of time researching best practices in reproductive health programs around the world, really. But based on our own experience, the expertise of our personnel, and what we really felt was going to be successful in these communities, we pulled together this new model in a way that's really quite unique from other groups, I think. So that's one reason that we're particularly excited about it, because it does seem to be pretty innovative from what we can tell from other groups around the world. And we are eager to monitor it and measure the results so that we can share what's happening with everybody that's interested. Question number 2. When working with men, what issues do you come across that contribute to the problem? Well, there are many issues when working with men. And I love men, so don't get me wrong here, but here in Guatemala, we have a pretty big problem with the macho image of the men. Oftentimes men believe that the more children that they have, the more virile they are, more of a man they are. They also have worries about if their partners or wives are using any kind of birth control, it must mean that she's out messing around, having affairs with other men. So there's a lot of insecurity there. And because the men are oftentimes the primary decision makers in a household, if they don't buy into the whole situation, then it's very difficult for the woman to make that decision on her own and use a birth control method, which is a reason why a lot of women use, say, the injection that's easy to hide from their partner. But what we have found through the years of working with the men, those are all sort of the perceptions of the macho man here in Guatemala. But what we find many times is that men really just lack information. So it's an ignorance about reproductive health issues that causes them to just say no when they first hear about it. So the more we're able to educate them, the more they open up and at the very least are supportive of what their partners are doing, even if they themselves won't go out and have a vasectomy, for example. Question number 3. How long will it take before data is available from the M&E program? Well, it should be very soon. Of course, we have lots of data from previous years, but that's what we have, is lots of data. So we haven't had ourselves set up in a way to be able to do lots of comparisons and be able to analyze the data. that we have been collecting. So we're being more strategic in the data that we're going to start collecting now in this new area. And we are going to be implementing our baseline surveys probably in March. So we should, as soon as March, we will start having that raw data that we can implement into our database. Well, and in fact, we had that activity last week, so that's already our first piece of data. From that time on, we will do some analysis on a quarterly basis of the data that we're bringing in, and on an annual basis, we'll be able to do a little bit more in-depth evaluation and analysis of what we're seeing, the trends that we're seeing throughout the year, that will help us tweak and improve our programs if that's necessary. The longer term impact data won't be able to be really analyzed until probably about year 3. Year 3 to 5 is when we can get some good analysis out of the longer term impact data. Let's see, question number 4. Can you elaborate on how the monitoring and evaluation data will be used? Yeah, so once we start having all this great data, it's inputted into our new databases that are much more user-friendly. We will use the information in a variety of ways. I think primarily we will use it to see how we can improve our programs, see what's not working, what is working well, and anything that we can tweak to better reach the folks that we're trying to reach. We'll share it with our staff always, and it helps them just be more mindful and understand better about the results of the work that they're doing in the field, which just also helps them feel more like a part of the team and creates that unified team that we're looking for. Of course, we will also share the data with the communities, with the beneficiaries, and so it helps them understand why this work is being done and the impact that it's having on their communities. It gives them the opportunity to talk to us and give their feedback on what's happening, and if they think that perhaps there's different kinds of data that we should be collecting as well. And of course, we use the data to report back to our board of directors, to our donors, and to the wider reproductive health community at large. We've been asked to present at some of the big international family planning conferences, and we're able to use the data that we have and the data analysis to share with the rest of the world just how great and impactful our programs are. Question number 5. Please remind me which type of expenses are more likely to be funded by institutional donors and which are not. Really great question. Institutional donors tend to be very restricted, you could call it. We have to create a specific budget for them, and then we have to, the reporting requirements for them are to show how we're doing the execution of those budget lines that we've done. They really tend to be more programmatic activities that they like to fund. They'd like to fund trainings, materials. They will fund oftentimes field staff, the staff that are directly involved with the field activities. They'll fund all the transportation costs and the per diems for that staff. But the things that they do not tend to like to fund are a bit more the indirect costs, what you might call overhead costs. For example, they may not want to help pay for the finance department work, which is so crucial to the life of the project. They may not want to fund HR people or any other kind of admin people, and they may not want to help pay for the office overhead costs, which, it's difficult to run an organization without an office and without your administrative staff. So that's sometimes where we get into issues about not getting enough money from the foundations. And that's where our individual donors really step up to the plate and help us out. Not that we expect all of our individual funders to only pay for overhead and administrative salaries, because that's no fun either. But so we use their money as well for some of the more fun pieces of the program activities buying the birth control methods, but we do use some of it to cover these overhead costs. So it seems like there are no other questions. So again, I would like to thank you so much for being with us today. I would just like to reiterate how incredibly important your support is. And if you have any friends or family that would like to get involved and support our team, please let us know. It's a great opportunity to give back to the community, really. I know there are a lot of people out there that say that, I want to help, but I don't really know how to help. So we can be an avenue for folks that are interested in supporting some of the less fortunate people in the world, and give you some direct access to really feeling involved and committed to the Wings family, so that we can put some smiles on faces out in these communities here. So thanks again, take care, and have a great rest of your day. Thanks so much.